Emerging placement is a placement in a non-traditional setting. So traditionally, occupational therapists are there to help people to do the things they want and need to be able to do. And there are a lot of settings in which occupational therapists could work, but at the moment they don't work. The focus for a Royal Emerging placement is to look at the community of those people, and it's to do some project work around improving the service for the people that use it.
At St Mary's College for my A placement. We would go into the classrooms and would usually be one-on-one with a student, so we may be note-taking for them, we could be speaking with them, helping to support their learning and also support the special educational needs teaching assistants. We were shadowing the sort of health and social care team and looking at what they did within their classrooms, and it was really useful because it was a lot of stuff that we had learnt, so sort of duty of care, compassion. We were working on our own sort of independent nutrition projects, so we were doing a variety of presentations to students. We also designed some nutrition posters for the canteen on healthy eating. We also did a pop-up stall on healthy eating and the dietetic profession for sixth formers.
So we went to St Richard's Academy, which is a primary school in Hull, and we were in their hub provision, which is for about 10 pupils with additional needs, and we worked with them to strive for a universal design to learning approach and be really neuroaffirmative with our approach. So I really tried to see the pupils as the expert on their space, and I worked collaboratively with the pupils and the teachers and their parents, and we looked at what maybe could be enhanced for their participation in learning. And I realised that all the children really like technology, so we got them to take pictures of what they liked in the classroom and what they didn't like in the classroom, and provide them just that space for them to open up and give their experience, so they could really make it like a classroom that they could learn in and enhance their participation and really just enhance their well-being altogether.
So we played a game of snakes and ladders with the children to explain the role of occupational therapy.
It's quite good to be able to have that sort of blank slate. You can go in, you can be the OT in that perspective, and you can just go in and you can be really creative with your approach.
Getting this opportunity in the school where all my placement is working with children, you don't really get that anywhere else, because if you're in the hospital community, it's obviously a mixture. But here I got to really work with kids that had that additional needs. I got to work with kids from age 11 all the way up to 18 years old. There definitely was some challenges. I think the first couple of days when we arrived into the school setting as well, it's very busy. It's very busy, and like I said, we don't necessarily have an established role to begin with, so I think you need to kind of have a pep talk with yourself and say, okay, I have a responsibility here. I need to take that bit of leadership to step up and just be able to communicate with people when you need that additional bit of support and things like that. But I think that was the main challenge. It's trying to find your place in the beginning and then realise, well, my place is what I make it, and there's a lot of room for that. And when we really did have excellent supervisors as well, and Cicely would come to us and say, this is your communication outcome, how are you going to meet that? Is that what you'd like to do? That's fine, these are how we can do it, and she'd give us all the materials that we'd need to do that.
We're in the forensic mental health setting.
There's no current physio there. We had our mentor who's gone in and asked a few questions to see if there's a need for it, hence why we've gone there as a Royal Emerging placement.
The fact we're there together actually has been really helpful, hasn't it? I think it would be a very difficult placement to do alone, just because of the setting. I think having two students together really sort of is a benefit, isn't it?
Yeah, we're bounced off each other, aren't we?
Yeah.
And maybe one day when you're struggling, I'm there to help, and vice versa. One of our tasks is to present what physiotherapy is, how we can integrate it there, what we've seen, positives and negatives. The physical health affects the mental health. If you can get someone just to walk somewhere, see the sunshine, or do something they're interested in, then you're going to have an impact on their mental health, and that could affect them for the rest of the day. This is why probably doing this kind of placement is really useful, because we've got the insight of doing it for 6 weeks and we can see how things are working and not working.
I think it has highlighted a huge gap in physiotherapy and mental health and well-being, and how the two aren't put together when they should be, because physio's supposed to be part of the holistic approach, isn't it?
Yeah.
But mental well-being and health is left out.
we kind of came up with gaps that we could find that we thought could help with their health and well-being. We worked with the children and they said they would like a games club. It was so much fun. We had such a good time. When we left, the kids I think they were sad to see us go. I think they were grateful for our input. We listened to them, they told us what they wanted to get out of the club. We provided a big pack of resources that they could take forward, because what they said essentially was, when we came up with the idea, they wanted to carry it on. It just gave us a challenge and a different understanding of how occupational therapy could work other than in the NHS or the council or something. Like, it just was eye-opening, because I feel like sometimes we are limited. You follow a path like, oh, you have to do this and you have to go in the NHS and you have to follow these rules and regulations, whereas here we were just free, we could do whatever we wanted.
It was 3 weeks and it was predominantly at Paul for Brain Recovery, and then 1 day a week I actually got some clinical experience within Huth, shadowing in ICU and on the neurosurgical wards as well, just to give me that extra insight and in-depth knowledge into acquired brain injury. My main task was to update the charity's nutrition and recipe guide that they have for their service users, which got really good response from the service users. They were really interested and really keen to hear about what I was doing, and they used this nutrition guide a lot through their recovery. I found that there was a lot of learning opportunities during my time on placement. For example, at the charity there was learning opportunities to learn about a different aspect of health that I wasn't very knowledgeable about before, and sort of learn where dietetics can slot into that and what role you can play and what impact you can have. And also within the clinical side, whilst in the hospitals on wards, that was a very big learning opportunity to learn about like the complexities of dietetics within critical care and why it's so fundamental to sort of in those very early stages of recovery following acquired brain injury as well. So my long arm supervisor I met with every week, just to sort of track my progress and check I was meeting the competencies and being consistent. Also to discuss just any concerns I might have had, and the conversations were very informal and open, so I could be honest about any concerns and just basically provide the best learning opportunity for myself. And then my on-site supervisor was readily available whenever I needed assistance, which was really beneficial for myself. They were always willing to discuss my work with me and see if what I was producing is what they wanted and if it aligned with the values of their organisation. So I often met with my on-site supervisor quite regularly, probably on a daily basis. For me, the role of emerging placement was learning where dietetics could maybe fit within a sector or an organisation where there isn't that prominent dietetic role as of yet. It was a good opportunity, and it kind of forced me to step out of the box a little bit and go beyond my comfort zone and explore a new area that I maybe hadn't considered before. So
working within the special needs hub, it's different to the mainstream classroom. Having the support for the children we've got is vital, like very tailored towards what they need. The occupational therapy students I had were Amy and Emily. They took a role in the classroom helping with working with the children. We had the 11 or 12 we've got within our hub. They had a massive impact. What I noticed was a lot was very child-led. As teachers and as a school, we're trained to teach the curriculum, but having these little side parts that just enable everyone to access it even better, that's what this course has allowed to happen, which again is what I think every school should have and need. The role emergent placement, to me, it really opened my eyes to what's out there and the role that should be within a school but isn't. And having that role would open up all the sort of pathways for everybody and would give the students exactly what they need when they need it.
It's a real opportunity. It's an absolute opportunity to promote the profession of occupational therapy, but also to give the students a chance to look beyond the usual health and social care and look beyond. It's like opening the box for me. It's like giving them a chance to shine, to look at things differently, to be innovative, to be creative, and to work in an area that they may never have even thought of before. And many of the Royal Emerging Placements actually on the back of having the students actually offer an occupational therapy post, which is wonderful. And that's, for me, that's my success. You can do anything if you use your theory and you apply your theory to your practice. You can work anywhere, and I think it's just trying to take the parameters off and actually think, what can I offer in this setting?
I think the Royal Emerging Placement project that we've really worked on this year has had tremendous success across the region, and tremendous success for the students themselves, for allowing them an extra opportunity to see what a difference they can make in a community. A Royal Emerging Placement is a chance where we get students that are looking to expand their knowledge and understanding of their pre-registration courses. It allows them an opportunity to be able to explore their skills in a new environment. So this can be anything from exploring their communication skills, their professional roles, their care values, and their application of those to a variety of different service users. So the Medical Health and Social Care Academy is all about trying to be able to widen participation. It's trying to be able to allow additional opportunities for our students here at St. Mary's College. But in addition to that, we work in direct partnership with a lot of our local universities in order to be able to really think about how can we allow students the abilities to train locally and then to get a job locally as well. And part of that is to be able to make sure that students have a success story when they take those next steps beyond us, when they get to higher education, when they have to take those next steps for their placement there and to apply those skills in an environment that allows them to flourish. They have left lasting legacies, and I think coming back today to be able to go through this reflection process has allowed some of those students to really see the difference in the impact that they have made. So for those within the St. Cuthbert's Trust that have visited our primary schools, they were talking, and the students are still talking about them, they're still talking about the difference that they've made. I think to be able to offer a Royal Emerging Placement at any organisation, you need to be willing to take somebody on that's going to give you new ideas, that's going to help you to think about things differently, but that's also going to be there to help improve your service and to be able to think about a difference that they can make for your service users. By taking them on, you're allowing yourself to be able to grow and develop as an organisation. Becoming a Royal Emerging Placement provider has been a 10 out of 10 experience. Without fail and without fault, we've been able to grow and develop not only as an organisation, but also with our local higher education partners in order to be able to help support their students to achieve success. I think having a quick training session ahead of time for what to expect can be really useful, and thankfully the LEAP is providing all of that for you to help along with those guidance. In addition to that, trying to be able to work with a long-arm supervisor or trying to work alongside the work placement coordinator at the Higher Education Institute can also be really valuable in ensuring that you've got open communication from start to finish. Clear deadlines and checkpoints, meetings set up can just make sure that the fluidity of the placement is as successful for yourselves as it is for the student. I think one of the added benefits of having a Royal Emerging Placement in a new environment, in a new organisation, or in a new setting, for instance, in a school where we might not have an occupational therapist, or we might not have a person who is a dietetics professional, by integrating pre-registration students in their placements in those environments, this allows them the capacity to be able to try and think outside the box, but quite early on, quite preventative, in a measure that allows us to be able to educate in a new way.
I definitely recommend the Royal Emerging Placements to others. I think it's something that people might overlook sometimes and maybe are a bit nervous about the idea that you'd be going in where there may not be someone else in your profession there, but I think it's important to realise that you really get that opportunity then to step up as a student where you don't have as much guidance, but then it's about developing your leadership skills, your own professionalism, really promoting who you are, what your role could be, and kind of making the people in this placement aware that, do you know what, actually you could make a difference, and you really get that opportunity to explore all different avenues that you wouldn't get in the typical type of placement. Yeah.
There was a lot of learning opportunities, and they really made us feel welcome, and it was just a really great experience.
Just good to have a challenge and a different experience. I was a bit nervous at first, but it was so exciting, it was such a challenge, and it made me realise there's a big world out there that I can do what I want, I'm not restricted.
We all enjoyed it, all of the children in the enjoyed taking photos. We've been told that the children are asking constantly when they can take photos, so it's nice to know that we've definitely made a difference.
It makes me feel happy knowing that I've made an impact and that is something that they are going to use to aid their recovery and just try and live like a general healthy life. I feel very proud that I've managed to do that.